Um, and anyway, we're going to be talking about responsive dementia care. And today I'll be talking about how you can how you can choose awareness, and also some attitudes. And tomorrow I'll be talking about choosing your actions. Most of you, or a lot of you, probably read this book. I've seen it. It's been around for a little while. And most of the information that I'm going to be talking about is in this book and a lot more. The artist named this beautiful gold mandala on the book Alien Brain, and that so fits. Dementia can change a person so much that learning to deal with their behaviors is like learning a foreign language. Today, I'm going to introduce you to this language via my avatar, Lucy, who lives in dementia land, if you will. Whenever you see her photo up in the corner, I'm speaking as Lucy. And when she's gone, I'm just me. Yes, in many ways, dementia is like living in a foreign land. As Lucy, I'm stuck here. I can't change, and so I can't leave. But you can join me. When my son-in-law was sent to Russia for 18 months, my daughter Sue went along. Sue worked hard to learn the language so she could communicate with the locals. And she found that they had different ways of doing things too. And she kept learning all the time she was there. It's the same for you. Sue chose awareness. You can too. Awareness means knowing all you can about your loved one and the disease. All those kind of things that Dr. Bateman was talking about, you know. And it's the who, the what, the why, and the how. Who is not only about your loved one, but about your whole team and how they can help you. Who is not only, or what is all about those diseases and the symptoms and the drugs that Dr. Bateman's been telling you about. Why is the reasons. Care partners sometimes say they don't care about why the behavior happens. They just want to know how to deal with it. But let me tell you, if you know why, it makes it a lot easier to know what to do to deal with it. And how is the action? Once you're aware, you're ready to use your own attitudes and actions to improve your loved one's behaviors. Early LBD symptoms tend to be behavior related. When LBD's hallucinations and thinking errors show up before memory loss does, they may be recognized as psychiatric symptoms instead of dementia. As Dr. Bateman said, LBD's drug sensitives to antipsychotics can make behavior managing challenging. Empathy deficit is common with LBD, but it's also an early FTD symptom with similar issues of non-recognition as a dementia symptom. Our book, Managing Cognitive Issues, is specifically about those early symptoms and how to treat them. Notice that Parkinson's is in the subtitle. PD is a Lewy body disorder that can advance into one type of LBD. Dr. Bateman explained that really well, didn't he? And people living with Parkinson's often hallucinate. That is, they see something that's not really there. These hallucinations are usually benign, but they tend to bother the caregiver more than they do the patient. Seeing children is common, or animals. We met Hank at a PD support group, and he told us about Blackie, his little dog, that just followed him everywhere. Blackie looked so real that sometimes Hank forgot he wasn't. When Hank's wife, Marjorie, reminded him that the dog was really just a symptom of Hank's disease, Hank would just shrug and he'd say, "Oh, that's right. But Blackie's good company, and I don't have to feed him." About 3 years later, Hank began to develop thinking errors. and his easy acceptance of Marjorie's corrections changed. Thinking errors occur when the brain can't do complex thinking. One of the first problems that a care partner might notice is poor decision making. Hank might go onto the computer and buy a lot of things. He won't stop to think about the need or the cost. He just sees something he likes and he impulsively buys it. Marjorie may not discover this until she discovers that her bank account is overdrawn, or worse, her savings are spent. Another thinking error involves sequential tasks. Lucy was an office manager before she had to retire. She had to retire early because organizing had become so difficult. She could remember names, but putting things in order was a puzzle she couldn't solve. Complex thinking is something we learn as we grow. We start out with very basic thinking skills. Consider the 2-year-olds that you've known. Their thinking skills are very limited. They live in the present, in the here and now. They haven't learned to separate themselves from others, and so everything is about them. Everything is black and white. No maybes, or used to be, or will be. Everything either is or isn't. As we grow, we gradually learn to reason. We become able to make choices and organize and plan. We begin to understand concepts like money and distance and time. We can see another person's side of an issue, and we start to being able to handle our emotions. And we stop seeing things in only black and white, either or, and begin to see the many levels in between. We could call this our logic meter. Over time, dementia takes away the ability to do complex thinking. That is, to reason and think logically. As it disappears, we're left with only the basic thinking skills we had as small children. Hank and his dog are a good example of this. As dementia appears, Hank begins to believe that Blackie is real. That's no problem for him. Hank likes his dog. The problem starts when Marjorie tries to remind him that Blackie isn't real, just like she always has. But now, Hank's logic meter is stuck on is, and he can't accept her explanations anymore. He knows that Blackie is real. And so he feels confused and hurt. Why is she lying? And he gets frustrated and angry. And Hank is now impulsive. And so once he gets a feeling, he acts. So let's look at this through Lucy's eyes. As Lucy, I can share with you the foreign language of Dementia Land. I happen to have LBD, but all residents here all residents here speak a similar language where behaviors are concerned, although symptoms may show up different depending on the type of dementia that's involved. Your view of me is that I remember family members' names, but I have difficulty doing things that used to be easy for me to do. You see me as slower, but you still see glimpses of who I used to be. But too much of the time, you see me as irrational and stubborn and childish. Well, I see it differently. As Lucy, I have the same personality and the same likes and the same dislikes I always did. I know I'm a little more forgetful and slower, but I'm still an adult and I deserve respect. I still think I can do the things I used to do. Well, not as well maybe, but I can still do them. And by the way, I'm not the one who's irrational. But the truth is that I am losing the ability to know what I can and can't do and to think rationally. I just don't see this. Empathy is something else I've lost. I'm the only one I can consider. I can no longer put myself in your place. All I can see is my view, my feelings, and my needs. Don't expect me to see your view or even to know what your needs are. As for your feelings, yeah, I see them. I see them, but I don't recognize them, not as yours. They're all mine. By the way, if I had FTD, this would be my most prominent symptom. When my reasoning fades, my emotional radar becomes very sensitive. And I become much more sensitive to my own feelings and to yours. The problem is, I can't tell them apart. And so they're all mine. I also sense when you don't mean what you say because your body language tattles on you. And so make sure that it and your words match. We all have positive and negative emotions, and we also have residual emotions too, which can be both positive and negative. Let's talk about the residual emotions first. Residual emotions are those that I remember from a previous experience. Dementia causes my cognitive memory of that experience to fade away. However, the feelings I had during the forgotten experience don't fade. In fact, they seem to grow stronger, just like we tend to hear better when we can't see. Now, positive emotions are a part of my body's healing system. They're soothing and enjoyable. That's true for everyone, of course, but it's especially important for me. When I feel comfortable and content, I don't feel the need to act out. Remember, I said that positive emotions could be residual. This means that there's still an emotional connection, even when cognition is gone. That's why you should continue to visit me, even when I don't seem to remember you anymore. Positive emotions are very powerful, but they're gentle and not very pushy. No. Negative emotions, on the other hand, are strong and they demand action now. That's their job as the body's natural warning system. As such, they're the first ones that I experience. Hey, danger here, they shout at me. And they block communication. They are so loud that I can't pay attention to anything else. And they clamor for action. And they make me obsessive about getting them addressed. The other thing they do is trigger my body up to gear up for fight or flight. My brain borrows oxygen from my thinking centers, which lowers my already limited ability to think. And then it uses the oxygen to increase my muscle strength. Be careful not to get within arm's reach of me when I'm angry. Now, let's talk about you for a moment. If you see a strange dog, your warning system automatically kicks in, and you get a warning of an emotion of fear, along with a theory that this dog might be dangerous. However, you can use your reasoning skills to evaluate the theory and then accept it or reject it. As Lucy, I see the dog, get the warning, and develop the theory, but my logic meter is stuck. And so I must accept the theory that the dog is dangerous, and that's my truth. So, how strong do you think that truth is? Let's talk about you again. Think about your home and where you live. I want you to actually do this with me while I'm talking. Do you think that I can convince you that this isn't where you live? You don't, huh? Well, let me try. I know you live there, honey, but you really don't. Did that work? Well, how about you used to live there, but you moved? You don't remember that you moved. That didn't work either. Well, what if I get mad? Would that work? No, none of it worked, did it? It just made you confused. And you stuck to your truth even longer. It just made you confused and annoyed, and irritated, and frustrated. And you knew I was play acting. How much stronger do you think Lucy's negative feelings would be if you were seriously trying to convince her that her truth was wrong? We'll talk about that tomorrow. But remember how I said that we attach theories to our residual emotions? Here are some common theories for themes for theories that I, as Lucy, might have. It's natural for me to feel defensive in response to my negative emotions. Since I must accept the first information I receive, I'm always right, and you are wrong unless you agree with me. Abandonment becomes common as I begin to see myself as a burden that you might not want. Remember, dementia translates may not want into don't want, into the present. As my diagnosis and my disease progresses, I feel a continual loss of abilities, of a control of who I am. And I often experience this as the theft of a personal item. My wish to go home is often another expression of loss. I want to be back in a time when my brain and my body worked better. While your interactions with me do affect my behavior, there are some other things that do as well. Mood disorders, pain and discomfort, those hallucinations I was talking about, and delusions that Dr. Bateman talked about quite a bit. And these are all made even more difficult by the thinking errors that overshadow everything. Mood disorders like these are very common with dementias. They are with most dementias, they're especially likely for me because I have LBD, and LBD targets dopamine, a feel-good hormone in my brain, in everybody's brain. These disorders make it difficult for me to be positive because they just cloud everything. And they amplify my negative feelings, and they become stronger and further overshadow my positive feelings, and they make behaviors more likely. Pain and discomfort can be body related due to physical triggers like my arthritis or an infection. I may not even know what's wrong, but these problems use up resources that my body needs for better functioning, and this can result in dementia symptoms like hallucinations or delusions and more behaviors. Discomfort can also be environmentally related and triggered by something I see, hear, or even touch. In either case, my behavior is often my body's way of telling you that there's a problem. Hallucinations are caused by damage to certain areas of the brain. With LBD, they're usually visual, but they can be due to any sense, such as hearing. Remember, Hank could accept that Blackie was just a symptom until he began to have thinking errors, and then he knew Blackie was real. A common definition for delusions is believing something false. But you'll have better luck with me if you think of it as a different reality. My only reality. Delusions are a symptom of thinking errors that keep me from considering anything except the first information that I receive, which is also one of those negative theories. Delusions can be triggered by real events, hallucinations, or even dreams. And they can show up as accusations, paranoia, misidentification, and the theory that he's talking about his girlfriend. Oh, sorry about that. Not anything I can do about that. It says my internet was unstable. Oh, I hope you can hear better. I hope it straightens out. I'm here in Arizona, and this is what it is. Okay. He was talking about his girlfriend, and I can't compute that my husband's been faithful to me for 50 years. That's in the past. I just feel the fear and know that he wants to leave me for her. But that's in the future, and I can only do the here and now. So I'm stuck with he is leaving me, and that's my truth, and that's what I act on. Paranoia is an unfounded feeling of persecution. When I experience a sense of loss, which can be delusional, as with my belief about my husband's unfaithfulness, or it could be real. For example, I might not be able to find my slippers, and they aren't just misplaced, they're gone. And my self-centeredness makes it personal. So they're not just gone, they're stolen from me. This naturally triggers my negative emotions and my obsessiveness. As far as misidentification, there's a couple kinds. The first one is capgrass. Capgrass is seeing an imposter, seeing someone close to me as an imposter. Lucy's gone for the rest of this slide, and here's Hank. He's worried that this woman who's taking liberties with him isn't Marjorie. Capgrass happens when Hank's brain misfires and sends him the wrong information because he's stuck with accepting the first information he gets. The wrong information is what he has to believe. However, capgrass is a visual symptom. If Marjorie talks to Hank before he can see her, he's more likely to identify the voice he hears as hers. Then when she does appear, his brain will match his sight with her already identified voice and see Marjorie instead of an imposter. But Marjorie must be sure to speak to Hank before he can see her for this to work. The second type of misidentification is often more emotional. Okay, Lucy's back. When I tell you I want to go home, especially when I'm already home, I'm most likely longing for what used to be, for more control in my life. Talking about it helps. Reminiscing, not explaining, as does time. Say something like, you look tired. Would you like to take a nap before you go? When I wake up, I will likely be accepting of where I am for now. Another answer is a change of scenery. Take me out for a ride. And then before we get back, be sure to talk about coming home so that I connect your verbal cue with the home that I see on arrival. Grandiosity, or bragging about unreal experiences, is usually benign and, of course, personal. The trigger is usually some sort of internal wish. Hank always wanted to be a big sea fisherman. And so dementia has turned his wish I was into I am. The best way to deal with grandiosity is just listen and go along. Now, let's talk about attitudes. Choosing your attitude makes a big difference in how I respond to you. Being accepting, positive, patient, empathetic, all make it easier for you to choose actions that support me and decrease my need to act out. Acceptance means that you understand that I can't change my truth. It doesn't mean you believe it, but it does show me that you respect my view. And that makes me feel validated as a person. Just that alone will decrease my negative feelings and my behaviors. Care partners have a saying, you can be right or you can be wrong. But because rest assured, if I'm not happy, you won't be. Remember Remember our exercise with your home and how strongly you felt about your truth? Well, with that in mind, okay. When you empathize, you share my worldview, the only one I have. You make an effort to see the situation from my point of view and to think about how you'd feel in that situation. You can do that. I can't. And then remember our exercise with your home, how strongly you felt about your truth. With that in mind, you can respond with what you think I need to hear. Because my positive emotions are often weakened by mood disorders and those pushy negative emotions, positivity doesn't come easy for me anymore. But don't forget my feelings radar. Your positive expressions like these can help to make me feel more positive. But even then, I probably won't act as positive as you do. It's just harder for me. You can help by being generous with compliments. They make me feel good. And since my logic meter is stuck on is, and now I accept them all at face value. And I need you to be patient. For me, the world is whizzing by like a speeding car, but my brain is struggling along like a car traveling in mud. And so practice patience. Take your time, pause a lot, and repeat as much as I need you to. Excuse me. Okay. But be sure to stay calm. If you go slow, but your body language telegraphs impatience, that's what I'll believe. I won't be able to concentrate, my ability to think decreases, and then, well, you can expect behaviors. That's just a taste of the power your attitude has. Pat's going to be talking a lot more about this in her segment coming up next. And tomorrow, we'll both be talking about action. But before we end today, I want to talk to you a little bit, I want to tell you about our new book. You probably recognize this one. A Caregiver's Guide was published in 2010, and it's been very popular. We're excited to announce the second edition, and it has the latest research and a lot of personal stories, and we've added a lot more resources. Our publisher is offering a 20% discount to our viewers. Just use this link and code to order your book. And these are all in your resource handouts, so you don't have to worry about copying this down here. And I wanted to go back. This is the book I talked about early on. And we have made the e-version of this book available free for just 3 days. Now, I need you to know that it's always available on Amazon for Prime members to borrow for free as a Kindle Unlimited book. We're not talking about this. We're talking about one you can download and keep forever. But it's only available for 3 days, February 12th, 13th, and 14th. You just go to Amazon and you buy it for $0. And finally, these resources and more are also all in your digital handout. Thank you so much for listening to me. I hope that you could hear and that the network disruption wasn't too bad.
Thank you so much for that, Helen. We really appreciate it. We have a couple of questions for you, okay?
Okay.
So Kathleen talks about her father being very paranoid, and he thinks that she and her husband are stealing from him. Mm-hmm. And it seems like when they go along with it, he gets even more upset. Could you speak a little bit more specifically about maybe how to deal with paranoia?
How? Going along with it is always the first answer, but I understand. Sometimes medication might be the answer. You know, if that doesn't work, then you take the next step and you say, okay, does he have LBD? Because if he has LBD, then the dementia drugs might help.
Okay, I don't know that, but it could be.
Yeah, but if he doesn't, like Dr. Bateman said, they wouldn't help. They might make it worse.
That's true.
Yeah.
That's true. We have a lot of feedback coming in saying thank you for your presentation. It's helping people realize where their loved ones are along the spectrum of dementia. So lots of thank yous coming in for that.
Thank you.
We did have a question earlier. Consider, and maybe you can address this for me. We talked a lot about medications for different people, but what can we do if someone won't really take those medications? Could you maybe mention other forms pills come in, or do you have any tried and true tips?
I don't really, but I know a lot of people like to put it in applesauce.
Okay.
That sort of thing. Applesauce, something that hides it, so that they a lot of medications will come in a liquid form instead of the pill form, and that's sometimes easier to give in a hidden form.
Okay.
And a patch. Somebody mentioned a patch. Patches are wonderful. Yeah.
Yeah. Okay. All right.
And no, I haven't. I just saw the wandering thing. That I'd have some answers to that, but I haven't. One of them is to use black holes.
Can you explain that a little bit more?
Well, if you put a dark mat in front of the door, it looks like a hole. And it makes it scarier for the person. Will usually, people do that. Nursing homes do that in front of elevators.
Okay.
And it keeps people from getting on the elevator.
Great idea. That's a great idea. Could you share the information again, or just tell us where we could get that free download that you mentioned earlier?
Oh, I thought you had it. I will make sure you do.
You have that, but could you just tell people what that's through? Is it it's a Kindle book, right?
Oh, the Kindle book. Oh, that. Yes. You go to Amazon, and you like it's a Kindle book. It's the digital version, and you usually will see it's free if you have a Kindle Unlimited, but you don't click that. You click buy, and on those 3 days, even though there might be another amount there, on those 3 days you should be able to get it for free. It should come up, oh, this is a zero amount.
That's wonderful. And I'm sure that will be good for people in other countries as well if they use that same Amazon link.
I hope they can. I don't know how it works for that, but I think it's for other countries too.
Okay, thank you.
We like to do that every so often with all of our books. We try to put them on for a few days for free every so often.
We appreciate that. All right. We have some more questions coming in a little bit about crabgrass syndrome, and when people think that they're living with imposters, when they're concerned perhaps about infidelity. Could you speak about that a little bit more?
Usually what happens is the loved one thinks they're being unfaithful. I had a friend, we had a very dear friend of ours developed Lewy body dementia, and he would, when his wife would crawl into bed with him, he would say, oh, I don't know you. I'm being, I don't want to be unfaithful to my wife. She turned out the light, crawled into bed with him, and the touching, he recognized her.
Oh,
I mean, it gives me goosebumps to talk about it.
very creative alternative.
Yeah, remember, crabgrass is visual.
That's a good point. Thank you. We have some other suggestions for, I think we'll talk about these tomorrow a little bit, but someone said you could add bells to a door to help with wandering.
So many answers. Because I specialize in LBD and wandering isn't a big issue with them, I bet the people that are out there know more about this than I do.
Sure, we'll see some good responses in our chat box.
Yes, do check them out.
Yeah. Okay. All right. I'm waiting to see if any more questions come in our chat. So Helen, thank you for staying on, and Helen's going to answer questions for us in our chat and our Q&A. And everyone else, take a break, get a glass of water, and we'll see you back at 1:10.